Kathy Brown, and I want to welcome you all on behalf of the Myasthenia Gravis Foundation of America. Before I introduce our speaker and get started, just a few housekeeping items. First of all, we want to mute the lines to assure that we have good sound quality on this call. So that means that we will avoid having feedback. So in a few minutes, other than Charlene, the lines will be muted. If you have a question, please type it into the little box that's at the bottom right of your screen, and then click on the little bubble, the little conversation bubble that's there, and then I will read the question to Charlene. And Charlene, would you like to hold those questions till the end, or do you want to take them as we go along?
Why don't I give you a break point, and then we can answer questions that look appropriate to that. And if you have questions that look like they might be saved till later, then let's hold those. Okay. I have 15 slides.
All right, great. So in another moment, we're going to do the muting. But I want to welcome our speaker, Charlene Hafer-Macko, who's an Associate Professor of Neurology at the University of Maryland School of Medicine. She's also linked to the Baltimore Veterans Administration Medical Center, and we're very pleased. She's an expert in this area, and she's going to be talking to you about the role of exercise in taking control of your myasthenia. Dr. Macko, it's all yours.
Thank you very much for this opportunity to talk. And if I get too soft, let Kathy know, and I'll just have her let me know, and I'll try to turn things up. So can I get my slides on now? Oh, there we go. So everyone knows that there's multiple benefits for exercise, and this is speaking very generally and not specifically related to myasthenia gravis. And you can see here Jack LaLanne, both his earlier pictures as well as his later in life picture. And we all know that exercise can help build strength. It also can build endurance, improve balance, and something that I think is very important, it can also improve posture, which helps efficiency of movement, both for activities as well as exercise. Many folks with myasthenia, because of the inactivity or because of steroids, have a tendency to gain weight, and those steroids also increase vascular risk factors. So exercise may be a way to help control weight and also manage risk factors such as blood pressure and glucose. With both inactivity as well as steroids, these accelerate the risk of osteoporosis and osteopenia, or thinning of the bones. Exercise, especially weight-bearing exercises and strength training exercise, can help rebuild the bone density. Exercise also can improve mood. There are studies in aging that suggest that exercise might be able to help with cognition when you look over the long term, and it definitely helps you sleep like a baby. So we do need to start with some caution before starting exercise. So before even considering exercise, you want to do several things. You want to make sure that your myasthenia is well controlled, that you're not in crisis. Before you start exercise, you should always consult with your physician. And this is both your primary care as well as your neurologist, to make sure that they're on board and that they don't have any limitations that they'd like you to work on first before getting into an exercise program. Also, if you have a cardiologist or a pulmonologist, you may want to see them as well. So that would be a heart or lung doctor. So for the next part, what I'm going to do is as you think about exercise, I think there's actually a step that you need to do before even getting started. And that's really to understand where your total daily activity tolerance is. And we're going to talk about this in length in terms of maybe having a activity diary to understand how activity, how your medications, and how your sleep affect your daily performance. So as you add exercise, this may reduce the amount of energy you have for the other activities. So we need to keep that in mind. So where I want to start, and this is where I'd like to take my first set of questions, is really understanding fatigue. In 1998, which is almost 30 years ago, there was a large study where patients filled out a survey about their myasthenia symptoms as well as their fatigue. And even though many of these individuals were well controlled, about 75 to 80% of them reported that they had fatigue. So even when the myasthenia is well treated, people reported that they had trouble thinking, they had fatigue with cognitive tasks, with physical tasks, and then also with tiredness or sleepiness. And I think to combat that fatigue, in order to reduce it, first we have to identify some of the causes. So these are things that I typically will do in the clinic once we get the myasthenia under control, or even as we're assessing early on, we want to make sure that there are other factors that may be contributing to the fatigue, because these would not include increasing the immunosuppression. So things like anemia or blood loss will make fatigue. Thyroid problems, which are very common with myasthenia. For women, hormonal changes such as the menstrual period, pregnancy, and the postpartum period can be times when there is increased fatigue and weakness. And in men, low testosterone can contribute to muscle weakness and fatigue. Potassium loss is another thing to consider. So some of the diuretics or water pills or blood pressure pills can actually lower potassium. Times when you're ill, when you have diarrhea or vomiting, there's also associated potassium loss that can increase weakness. And as you're probably all well aware, infections and other inflammatory conditions can make myasthenia much worse. And as you know, on the myasthenia website, we carry, and on the MyMG app, medications that are known to aggravate myasthenia. So before starting any medicines, you want to make sure that you talk to your primary care, your neurologist and pharmacist to make sure that these will not affect your MG. Sleep disorders, obstructive sleep apnea or restless legs that occur at night called periodic leg movements can interrupt sleep, so you never get to that deep reparative sleep. And then surgery, the physical healing that occurs with surgery can sometimes make the myasthenia worse. So this is the part, there we go. This is the part that you actually may be able to have input to help control some of these factors. Heat will make myasthenia worse for many individuals. So recommendations for that would be looking to see if you can keep cool, stay in the air conditioning as much as possible. If you're going to do activities, plan them for earlier in the day or in the evening when the sun is not so bright. There are cooling vests that you can use or cooling towels that actually will help lower the temperature. Drink lots of ice water to keep cool on the inside as well. Overexertion. So if you take on a task and you're not kind of mindful and not pacing well, this may make the myasthenia temporarily worse. If you want to perform well, you got to put good fuel in the tank. So making sure that you're not missing meals, make a good balanced diet. Make sure you have good sleep hygiene. So it's not just the sleep disorders. It may be, if you're, it's too hot in your room, or if you're going to bed with the TV on. You want to do things to make sure that you can fall asleep well without distraction. Stress, if you're under a lot of stress, you want to maybe get a therapist and help you decide which things you need to worry about. You got to know good things happening in your life to not make that a focal point. Depression and anxiety can often look like myasthenia, so if someone is under a lot of stress, this is something that we want to address head on, because we don't want to be increasing immunosuppression if depression is at the root of fatigue. And then simply deconditioning may be another thing that may contribute to fatigue, so it may take time to recondition the body. So I don't know if you have, if there's any questions. We'll take a few now, and then I'd like to go on from there. Kathy?
Yeah, so Karen has a question. Is low testosterone only a factor for men and not women?
More commonly, we'll find problems with low testosterone in men, especially as they get older in age or after some hormonal treatments for prostate cancer, where we try to shrink the prostate. For women, it more often is the changes in the estrogens and progesterone.
That's actually, right now, that's the only question.
Good. So in getting started, this is a part that I think is very important for everyone, even if they're not quite ready to start their exercise, but are really trying to learn how to wrestle with their myasthenia and how it affects them in their daily routine. So one of the things I like people to do is to keep a diary. And I think this is very helpful as you're learning your medications. You're really trying to understand how the myasthenia affects you. And so what I ask folks to do is write down their activities. And many people don't realize that simple things that we do, we call them activities of daily living, actually can be very tiring, especially when the myasthenia is not well controlled. So dressing, when you bend over in the chair to tie your shoes, many people get very short of breath in this position. Putting pants on is a big activity. So what I like people to do is write down the activity, get an idea of how intense that activity is and how long it takes them. So normally it takes us a few seconds to put on a pair of pants, but if the myasthenia is bad, understanding that may take 5 minutes. So as the myasthenia gets better, we have something to look back on, and a lot of folks forget where they are in the beginning. Fatigue. So if you're going to the grocery store, what I like to do is take a scale of 0 to 10, and I have this at the back of the presentation, where 0 means you have no fatigue. You're just feeling like the Energizer Bunny. 10 means this is the worst fatigue. You can't, you really can't even move in bed because you're so tired. So before you start the activity, see where you're at. You should mark that down. And then after the activity, write where this activity, how it makes you feel. You want to know how much exertion, how much energy did it take out of you, how much, how intense was the activity you did. How long did it take to recover? So if you went to the grocery store and you need to just sit and relax for a half hour, we want to know that. So as you start becoming more active and increasing your activities very slowly, if your recovery time gets shorter, we're making progress. You want to note how many naps or physical rests that you take, your body rests, and how does this activity affect your myasthenia. And then Bill, I just see down there, said also you want to think about how it affects your how your Mestinon affects your activity. And so what I have is I sort of made a very quick little piece of graph paper. You can take and put 10 tick marks. I only have like 6 because I didn't have enough room. But have a scale. You can see on the left side of the scale, 0 means no fatigue, 10 means the worst fatigue. And write down your activities. And if you look on the very top, I put when this person was taking Mestinon. So this is someone who was taking Mestinon every 4 hours. And this is a person whose Mestinon lasted about 4 hours for them. So they got up in the morning, they were feeling really good, and then they took a bath. Maybe it was a little too hot, and after that, it wiped them out, and they were feeling at about a 7 in terms of their energy level just from taking a bath. And that's common with myasthenia, especially early on. They took a rest, and you can see that the fatigue level came down around a 4. Then the fatigue started increasing as they were getting out to the end of their Mestinon dose. And this is very important information because if you can quantify where you are with the myasthenia, how the Mestinon lasts, is it doing what it's supposed to, or is it wearing off early, this will help your neurologist or your primary adjust your medications with you so that you get on a regimen that's best for you. If you look from noon after they took that Mestinon, that fatigue level went right back down around 4 and stayed that way, and it looks like right around 4 that the fatigue increased back up around 7 again because it was time for Mestinon. Then the person needed to run and get the prescription from the drugstore, and it was one of those very quick in and then back out just to get the prescription without waiting long. And they were only in the store 15 minutes, but it really took a toll on them, and the fatigue increased. So they had to rest, they took their Mestinon, and the fatigue came back down. So this is a great way to help you understand the impact of your regular activities and your Mestinon, how it is helping. So hopefully that helped with Bill's question. All right. Now, there was a question about why they don't feel the benefit of Mestinon till the 3rd dose. So sometimes everyone is very different with their Mestinon, and so it's possible if you get a very good night's sleep that your myasthenia is doing very well. You're covered extremely well in the morning, but later in the day, the fatigue is much more pronounced as you've had repetitive activity or prolonged activity. That's often people, I like to know when people feel very fatigued early on in their disease. Is it around 10 in the morning? Is it at 2? Or is it right before bedtime? So it may be in the afternoon you've hit your maximum fatigue, so you really need that last Mestinon dose. All right. So the other things, once you start doing activities, so once you start with an exercise program such as walking, or you're on the elliptical, you're on the bicycle, or you're doing some strength training with a trainer or a physical therapist, I think it's important to quantify your activities and keep track of it. And this does several things. One, it helps you see the gains that you're getting. It makes sure that you don't overdo, because if you can do one activity but it takes 3 days to recover, you've done much too much. So you want to back that activity down so that you can do it at least 4 times a week. And we're okay starting with 5-10 minutes. We really don't need a lot of activity as you're getting started, and we slowly build that up. So keep note of the time, the distance if you have distance, and then the intensity. This is easy if you're on one of the exercise machines, but if you're not, if you're outside walking around the lake, you say, I walked quarter way around the lake and then came home? How many rests did you need to take in order to get home? And we want to see how you progress. One of the things that I recommend is the having on the smartphones, they have step activity built into many of the applications. The other thing people are using are the Garmin's or the Fitbits, or not to be to pick any of them, but there are many different step activity monitors that everyone is wearing. So what I ask folks to do is to give me the range of the steps they're taking. So maybe it's 1,500 steps a day. And what I want to know is, within the number of steps folks are taking, where are they comfortable? Where can they sustain activities and it's not ruining a day by doing too much? So also, if you do the max, then you're going to pay the price, and you may not be able to do a lot of activities later in the day, or it may change what you do over the next several days. So find that range that you're comfortable. And I usually ask people to stay there in that range. So maybe it's 1,500 to 2,000 steps. If that's where you're comfortable, stay there for a few weeks, and then just gradually challenge that by maybe adding 200 or 500 steps. You also want to record your times. How long do you sleep, and how restful is that sleep? Because if you're not getting a good night's sleep, that's going to contribute to daytime fatigue. So, Kathy, I think this is a good place. This is a very good place to stop, and then we will come back. Oh.
Okay.
Yeah. I've done something. Did I lose? I don't know what I did to my, I've canceled out of the screen. There we go.
You got it?
Yes, I did.
Okay. So actually, Bill was not asking about methadone, but about melatonin, and using that, I guess, as I believe it's a sleep aid.
Right. See, that's why you're reading these for me, Kathy, because I can't read them. So, you know, myasthenia is very difficult for addressing sleep needs, because many of the medications that are prescribed for sleep, like Ambien, melatonin, Benadryl, can all affect myasthenia and cause weakness. So you want to be very careful with these. So everything we do is a risk and balance. So it's you need to talk to your primary, talk to your neurologist. And melatonin is it's an over-the-counter medicine that many people have used to induce sleep. It is a metabolite of tryptophan, which is turkey that you get at Thanksgiving time, and the big meal makes you tired. So I think it's always important to ask your primary whether this is okay for you, and knowing where your myasthenia is.
So I'll just jump in because he had a part 2 to that.
Okay.
And that was, what about antidepressants? I lost that for a second.
And what about antidepressants? Many of the antidepressants actually have sedation as a side effect. So taking those at night can help with 2 problems, sometimes treating depression, helping a little bit with sleep, and some of them also have a pain, they can help treat different types of pain. So again, this is a question to take up with your primary care, your neurologist, and really look at the balance of your other medications, see where your myasthenia is, and deciding whether this is important for you to get a good night's sleep in part of your looking at you as a whole with your myasthenia.
Okay, so Alan asks, he's moved to Florida and feels better generally. Is there any research to back this up?
Well, Florida is really a nice state. So So I don't know. Alan, I've actually talked to Al before about this. Many individuals with myasthenia will find that heat really makes the myasthenia worse. So when you're out in the hot sun, when you're taking a very hot shower. Now, for other folks, a hot shower helps loosen up some of the muscles. Some people perform better in the heat. This past year, I've had 6 or 7 people who say when they're fighting that bitter cold, this really aggravates their myasthenia as their bodies are trying to stay warm in that very cold weather. So I have not seen the heat making myasthenia feel better. There is some literature on cooling that people have used cooling vests, and physical performance is better with myasthenia as it is with multiple sclerosis.
So Kelly Brewer says, I've tried melatonin and it seems to make me lose muscle function.
And that's really why, with anything with myasthenia, it's so important to talk to your primary care because it definitely can have this effect as well. So be careful and make sure that you have someone supervising your plan. And even though these are herbs and vitamins, they still are quite potent and should be discussed with your care team. So I'm going to go on, and so in terms of exercise in myasthenia gravis, there really isn't a lot of data yet, and I'm hoping to publish some. We have some excellent results. What is in the literature was there was a resistive training or strength training that was performed on 11 mild to moderate myasthenics. And this was a 3-time-a-week for 10 weeks strength training program. And they did it on one side of the body where the other side served as a control. So the first question was, can people with myasthenia exercise safely doing resistive training? They found no adverse effects. So in a supervised setting, it was very safe. On the side they exercised, they had improvements in the quadricep, which is the big anterior thigh muscle, so the thigh muscle right as you're looking down on your leg. It increased strength by about 23%, which in many studies of aging, this is the amount of strength gains that is expected to get. There wasn't any change for biceps or triceps on their force testing, but it was well tolerated. Where most of the data really has focused for myasthenia is addressing the troubles breathing. So there are 3 studies in the literature. One of them is a randomized, which means people got randomized to control just a home exercise program versus a pulmonary care breathing program where they learned how to engage the diaphragm in breathing. They learned how to take deep inspiratory breaths, and they found that they were able to increase the breathing capacity during the pulmonary training. Unfortunately, when people stopped doing the pulmonary exercise, the pulmonary parameters went right back to where they were. There are no studies of aerobic training, such as treadmill, the bicycle, elliptical, but in our study we have shown great gains. So this is the scale that I wanted folks to take a look at. This is a fatigue scale that I think you should take with you to the gym, to the store, and this is something that I think you should use when you're doing your activities to make sure that you report where you are before and after the activities. And this is the scale we use. This is very complicated, but essentially it's blue is the light intensity. So how did this exercise feel? So in the blue, this is typically doing activities of daily living that really should not tax you, but myasthenia, it may move you into that green level or even the red. When people are doing exercise, in the targeted range. It should be in the green level. You should feel somewhat hard to heart, but we don't want to get into that very hard or maximal exertion that you just can't keep it up. And so I like to mark where people are. I might skip this one. So do you have a couple questions? Kathy?
Hi there. Actually, I guess I missed one earlier. It says, why may it be that I do not feel the effects of the Mestinon until after I take the third dose?
Oh, I thought I answered it, but sometimes the fatigue gets so I actually think it has a lot to do with sleep, and this is just a conjecture because, I don't have your actual history, so I can't go through things, but a lot of times if you get a very good sleep at night, myasthenia does much better after a rest, and so most people find that they do much better, they perform much better in the morning. So I often suggest that activities be performed in the morning, working in the morning. If you can only do 4 hours of work, then doing it in the morning hours rather than doing it in the afternoon. Although I have some folks who feel better as they get going in the afternoon and do better. So there's always an exception to the rule, just in life as well as with this snowflake disease. But as that fatigue increases, I think you can actually feel the effects of the Mestinon more reliably than when you're taking it when the myasthenia is under better control. So hopefully that answers that question.
It seems that someone else is typing but hasn't completed yet.
Okay. So this is where I think this is almost my last slide or next to last slide. In looking at your training goals, I think instead of planning for an exercise program, I think it's important to plan more for health and wellness. And so looking at this in the long term, many folks with myasthenia have had it for many years and maybe just starting with their exercise program. So we have years that we have to sort of reverse the physiology and years of prednisone to counter those effects. So we want to think about exercise as a part of the plan, and just like many medications, we add them in slowly and titrate them to side effects. So don't be too gung-ho. Let's start slow, and you're building life habits. Be realistic in your goals. Start conservatively. Plan for rests. Be very mindful of your posture as you're doing your activities, because you can take a low-intensity activity, and if you do it with good posture, we engage the whole body and can get more bang for our buck. Allow adequate time to assess the impact on your myasthenia. So instead of advancing your routine every day or every week, you really want to do it over a 2-week or even month period of time. So slow for success. You want to keep that journal. That's so important to help you reflect on where you are. Find a training partner, and you want to share your journal with your physician or your care team so that they can have some feedback to help you. Let's see if that's the last slide there. I think it is. Good. So do you have more questions, Kathy, that have come through?
We actually have a little bit of interaction.
Okay. Oh, good.
Okay, so Tom says that Marcia could try using time-release Mestinon overnight to see if she has better results. But Marcia said that she didn't do well on the time release. Go back to the snowflake idea. And then we have something from MJ. Are there any vitamins that can help?
Yeah, so let's take the Timespan Mestinon. So everyone is a little different, and you need to talk to your doctors. But with the Timespan medication, I don't like to use that through the day. I like the Mestinon. I like how the regular Mestinon lasts through the day. I think the release is more true for the activities that you're doing through the day, and it's easier to judge how long the medication is working as if you work with your physician and start to keep a journal and understand how long it is active for you. That may change as the immunosuppressions have been added, if you have a sleep disorder that gets treated. I use Mestinon for the individuals who wake up and are having trouble swallowing or breathing, either through the night or in that very early morning stage, where they've got to get up, take their Mestinon just to be able to eat breakfast. So this helps give them a little coverage in the morning. As a caveat, it looks like the insurance companies are starting to deny Timespan insurance for some individuals, so they're having to pay a lot more out of pocket for those co-pays. So we've had to go back to regular Timespan through the night, which I don't like individuals waking up in the middle of the night to take a Timespan. So next question was about the vitamins. Vitamin supplementation is really something you need to discuss with your primary care, your neurologist team. For individuals who are on prednisone for a long term, we like to use calcium and vitamin D to help counter the effects of the prednisone and steroids on the bone density. And I often screen for vitamin D deficiencies because low vitamin D can contribute to fatigue and lower muscle performance. Vitamin B12 is another factor, which I should have had on our list, that when it's deficient can contribute to fatigue. So I suggest checking B12 levels and seeing if it needs replaced. In terms of vitamin supplements, I think the best way to get vitamins is really through natural foods rather than the processed vitamins. So anytime vitamins are added, you need to discuss with your primary and your neurologist. All right, so do you have a couple more questions now?
Yeah, so Kat says, and I'm sorry, the screen is changing even as I look at it, so I just need to scroll back up there for a second. Sorry about my hesitation here. I'm just trying to find the one that I was at a moment ago.
So I'm going to take, I can't see if it's TH or SH, but it asks if I have any guidelines about the number of repetitions of exercise that should be performed at one time. I don't, and I think I usually start extremely conservative, and when on the weight machines, many people start at 60% of their one repetition max. So going to however much they can lift at a maximum, and then multiplying that by about 60% or a half, you eventually, ideally, would like to get to multiple reps for either strength training or endurance training. But with the myasthenia, I think it's good to start conservative and maybe start with 5 reps, see how that goes. In 2 weeks, do 5 reps, 2 sets of 5 reps, and then start building on from there and seeing how it affects your fatigue, not only at the gym, but also later in the day. All right, did you find it yet, Kat?
Yeah, so I was looking for Kat, and Kat says, I know that very strenuous physical activity results in immunosuppression. Has this ever been examined in the context of autoimmune disease that you are aware of?
Well, very strenuous physical activity is not good for the body. It's just like too much emotional stress is not good for the body. It increases our cortisol levels. It affects our cytokines. So I'm not a proponent of doing a very strenuous activity. I really think what we need is good starting light and building good physical activity. So yes, very strenuous activity is not good. There isn't data on this in terms of myasthenia specifically, but I think you really need to get advice as you're getting started, whether it be with a trainer who you may have to train them about myasthenia, physical therapists and occupational therapists, exercise physiologists. Some know about myasthenia, but often we need to help coach them and let them know that with the myasthenia we need to start slow and with low activities and gradually build to tolerance. Because many people have started into a program and it tires them, it makes them feel much worse. So I think always supervision is good.
So then Bill DiLorenzo says, what about Timespan for overnight flights, that is to Europe, because of the time change? When one arrives, for example, in Rome, it's early morning.
That's a good idea. I haven't had any myasthenics in that situation, but it means that the myasthenia is doing very wonderfully to do that kind of wonderful travel.
All right, and TH says, should one stop as soon as the next repetition is not as strong? I am very prone to getting a tendinitis easily. I believe this is from weakness that is not really apparent during exercise.
And I think you're probably right. So with you getting a tendency to tendinitis, the tendons are the connective tissue that holds the muscle to the bone. So it means that your muscle activities that you're doing are pretty vigorous, and so they're straining the tendinous tissue. And even without myasthenia, it takes several weeks to even months to really build and toughen that tendinous tissue. So to me, it sounds like I would stop probably half what you're doing and see if that makes a difference. You might want to get a coach, get a physical therapist, occupational therapist, because whatever you're doing, your form may be off a little bit, so a simple modification of the activity may help reduce some of the strain that you're feeling on the muscle and the tendon. But I would start with half. I would really take that down and maybe even take a few weeks off if you're getting that tendinitis, so you have gone a little too far.
So next we have two thoughts from Carla. One is, would you suggest starting out with physical therapy before an actual exercise program in a gym? And then part two, the PowerPoint will be available on the website.
And unfortunately, the reason we're all muted is the last one we did had so much echo, so we actually couldn't take our recorded webinar to put onto the website. So we'll both have the webinar as well as the PowerPoints for you to download. I do like physical therapy for individuals with myasthenia because I think I'm always in favor of prevention. So doing a good assessment of posture, looking at how to build endurance. Now, not all physical therapists are created equal. Some are very good for orthopedists and will do multiple repetitions and build good range of motion, but others are good for neurologic diseases. Some still aren't aware of fatigue, and so we have both a physical therapist who is associated with MGFA, as well as a woman who's now getting her PhD in occupational therapist. So what I'm hoping to do is we'll get them engaged in the MGFA and really get a program of awareness for their peer group as well. So yes, I do think physical therapy is good.
I'm not seeing any more questions. If that's the case, I will start wrapping up.
Oh, here we go.
Thomas Larson is typing, it says here. So Tom, we'll give you a minute for typing your question. And I'll just say again that we will be posting the webinar. Oh, Tom says thanks and hugs to Charlene.
Thank you so much. And we had an absolutely wonderful exercise group at the MGFA National Conference. So.
And I just see that Marcia is now typing. She's also saying
Okay.
thank you.
And thank you to all of you for participating.
I just want to remind everybody we will have this up on the website. Give us a couple of weeks because we'll have to go through a little bit of editing and cleanup, and then it will be posted. So another thank you, this time from Sandy, and I think you're getting more thank you notes. Sandy, to Tanya, to Reese, and Melissa. Yeah, so I think the whole crew is saying thank you. And thank you, everybody, for participating. We really do appreciate your involvement, and good luck with your exercise.
Yes, good luck to you all. Have a very good evening.
Good evening, everybody. Take care.